Hi, I'm Dr. Mike McCracken, and I'd like to talk about 5 things I like for my patients to know about upper blepharoplasty surgery. The first is, what is upper blepharoplasty surgery? Upper blepharoplasty surgery is a procedure where we remove excess skin and fat from the upper eyelids, and it is done either to improve the appearance of the upper eyelids, or sometimes we do it to remove restriction in the patient's peripheral vision. The second thing I'd like my patients to know is about the anesthesia for an upper blepharoplasty. Upper blepharoplasty surgery rarely requires that the patient be put to sleep for the surgery. Most of the surgeries are done in an operating room with an anesthesiologist there to keep the patient comfortable with medication through their veins, in addition to numbing medication that I use in the eyelids. Sometimes we do upper blepharoplasties in the office just with local anesthesia. The next thing I like to talk about is how the procedure is done. Upper blepharoplasty surgery is performed either with a laser or with traditional cutting instruments. We remove the excess skin with an excision in the eyelid skin in the crease, and then remove any excess fat that needs to come out as well. Then we close the incision with stitches. These stitches usually come out after about a week or so. The next thing I like to tell my patients about is the recovery from upper blepharoplasty surgery. First off, there is very little discomfort after surgery. Most patients do fine just with some Tylenol. Sometimes patients will require some additional medication as well. The next thing that I think is important for patients to understand is that they will have some bruising and swelling for 1 to 2 weeks after surgery. This can be helped by using lots of ice in the first few days after surgery, and there are also some oral homeopathic medications that can be used to help with this. The last thing I stress to patients that are working is that they should probably take about a week off after blepharoplasty surgery, or they should wait until the swelling and bruising goes down before they go back to work. The last thing about upper blepharoplasty surgery that I like patients to understand is that sometimes additional procedures are performed at the same time. Sometimes patients need ptosis surgery to tighten the muscle that lifts the eyelid if the eyelid is droopy underneath that excess skin. Some patients will also need to have a brow lift performed if the eyebrow is sagging and contributing to their tired appearance or reduced peripheral vision. Another commonly performed procedure is a lower blepharoplasty, where excess skin and fat are removed from the lower eyelid at the same time as upper blepharoplasty surgery.